Hi, I'm Patty Dreier, Portage County Executive, and welcome to Portage County Matters. It's a monthly show that highlights what's happening in Portage County with a feature story about something that you can learn about to get to know your community even better. Today, our feature story has to do with the Portage County Healthcare Center, so I'm looking forward to that part of the show today. But let's start out with that quick news update that we do each time. From the highway standpoint, we've got some construction happening that you probably noticed at County HH and R intersection near the Portage County Business Park. And this is a construction project that has entered phase 2 now to do some utility work. It's a large project that will take some time and actually keep that area under construction through most of the rest of the summer. So thank you for your patience. If you need some extra information about what's happening with that project, or you just are curious, you're welcome to give our office a call. From the purchasing standpoint, our purchasing department has got some changes happening, and those changes deal with the hiring of our new procurement director. Our procurement director is Matt Fleming, and Matt will start work on June 1st. I'm really excited to welcome him to our community. This is a small department of 3 individuals, and it's being reorganized to function more effectively and efficiently, and to improve some services that are really important to the hub of our operation in Portage County when it comes to purchasing anything from computers to snow plows. So I'm really thrilled about the progress that's being made, and the fact that we will have an internal audit for that department this year. And that internal audit will lay out a strong plan for us, for Matt to have a nice work plan that guides us into the future. So we're making a good deal of progress in lifting up this department. It had some major troubles from my first day on the job, so we're going to be improving its function in relation to monitoring county contracts, and also playing up its role related to inventorying our fixed assets in Portage County. So please join me in welcoming Matt Fleming and his family when they come in June. They're moving here from Rockford, Illinois. The governor's budget repair bill. I've spoken about this the last couple of months, and I'm sure it will be on future updates as well. Portage County is planning for its transition after June 30th, when 6 of our 7 union contracts are finished, and we transition into what I've been calling a new normal for Portage County. In accordance with the governor's proposed budget repair bill, there will be a change in unions that affect all of our public workplaces. Except for our union related to deputies in the Sheriff's Department, we need to develop a new set of human resource policies that guide us forward after October 1. And what we're doing now is we've set up a transition team in the county, and we have a structure and a process identified with lots of different people involved at many different levels. And so please stand by for more information on this next month. It's a comprehensive undertaking, and basically we're changing from one way of doing business to an entirely new way of doing human resource business in the county. So it's maybe one of the bigger tasks that we'll have undergone in a very, very long time. Strategic planning, as I've spoken about at last month's show as well. Departments are now wrapping up their first level of strategic planning with their oversight committees, and I've been really pleased with the progress that I've seen. This is that 10,000-foot view, that broad level view of planning. There's much more work to do as the months and years roll on, and we drill down for details, and we set up accountability structures to accomplish various parts of work plans that are associated with the strategic plans. Looking forward to it, though. But there is still time for you in this round of planning to share your visions and views. So I'd like to ask you, what are your priorities for Portage County, and what matters to you in your future in Portage County? If you'd like to share your ideas, please call our office or write a letter or an email, and I'll be sure to include your thoughts as we're putting together this next big set of priorities for Portage County. There are 2 other notes of news, and then we'll get on with the guests here today. The 2012 budget, I wanted to provide you with a little bit of an update. The state's biennial budget is due to be passed on time, that is by June 30th this year, so that it will roll out its new structure on July 1. As I look ahead, I don't have enough information right now yet until that budget is passed to be able to put the frame together for our county budget. But what I can tell you is that I anticipate that many of you will experience changes in the coming year and years ahead that will relate to how you've known county and state services to help you in the past. We're going to have some big changes, so I just want to get you prepared to start thinking about that and be ready for us as we all have to make these shifts and adjustments together. And then finally, energy planning. I've mentioned last month that I had been participating with a lot of other members of our county board and staff on developing our Phase 1 energy plan for the county for facilities. And I met recently with our key staff in facilities and finance to begin developing a financial strategy so that we can take the planned steps in our strategic energy plan and move them forward. And so I'm thrilled about what we came up with so far about capital and non-capital funding strategies, and we will have more to share with you soon. I'll be discussing these ideas very shortly with members of the county board. So there we go. We just have to make sure that we don't let this plan sit on a shelf, especially with rising energy costs. And from the energy standpoint too, the other thing is that we just now started on Phase 2 of energy planning, and this has to do with our transportation fuels, and this is also none too soon, as we know where those energy costs are going. We have to be smarter about how we manage energy in Portage County. So that's the news update, and what I'd like to do is transition to our main story of the show. Portage County Matters this month is related to the fact that May is Nursing Home Week. It's always Nursing Home Week around Mother's Day, which I learned just recently, and I thought that was kind of a cool tie-in because so many of us are trying to do the best we can to care for mom and dad. And so anyway, I thought it would be a great month then to feature the Portage County Healthcare Center. And so I'd like to welcome our guests today. We've got Dave Rademacher, our new director of the Portage County Healthcare Center, and Stephanie Inman, our director of social services there. So welcome to the show.
Thank you.
Now, Dave, you're the new guy on the block in Portage County. I had the honor of participating in your search and screen, and how is it going for you in your 4 months here, getting your feet on the ground and being welcomed into the community?
Well, I've been overwhelmed with awful lot of positive comments from family members, residents, about the care that they receive from the staff at Portage County. And the staff and other departments within the county have been very welcoming, and I've just really enjoyed my first 4 months.
Wonderful, wonderful. And Stephanie, well, you've been on staff for what, 6 years or so, and you started as an intern.
Yep.
I think that's a cool story. You mind, highlighting that a little bit?
Yeah, I started as an intern. I worked in through UWSP. I was an intern, and then they called me back, and so I worked as a limited term employee as a social worker, and then got hired on as the part-time social worker, and then became the director.
There you go. You stepped up the chain.
Yep.
Wonderful. Welcome.
Thanks.
Now, I just want to make a clarification because folks like me don't know this until I had the chance to get to know you better and know the healthcare center better. But when I'm a person who is shopping around, let's say with mom, shopping around for a suitable setting, a healthcare center to help meet some needs, whether they're nursing home needs or whether they're rehabilitative care needs, Stephanie, you're one of the first people I might talk with as part of the admissions team there, right?
Definitely. Yep, I work very closely with our nursing staff and our other social worker, as well as Dave, obviously, to kind of coordinate for people coming in for whether it be, like you said, short term, whether it be following an elective surgery, a hip replacement or a knee replacement, kind of coordinate with the hospitals and the case management staff there. And then sometimes we also work with people coming in for long-term care, whether it be through their physician's office or other staff helping to coordinate that transfer as well.
Excellent. So again, this is great. I've got the front line of the Portage County Healthcare Center right here with me today, and I think that's a really important piece for everybody to understand. So let's talk about the healthcare center itself. Now, Dave, the mission. the mission of the center, and how long have we been around, the center been around?
Well, the healthcare center's mission is to provide high-quality, individualized, cost-effective residential and rehab services we talked about with people needing short-term stay care for elderly and adult clients with both short-term and long-term care needs.
Wow.
And the Portage County facility actually had its beginnings back in 1931. Was when the original building was built, and it originally housed 62 residents at the time. And through progressions of some additions in 1965, we added our north and south wing, and our capacity increased up to 137 residents at that time.
Wow.
And then we did have a couple of additions to our building. We added our east wing in 1989, and then in 1994, we also added the new addition to the front of the building. So it's been a progression over a vast number of years, but we've been around for a long time providing services to the community.
Well, I was over at the center yesterday for when we had our staff meeting, and it was great because right in that front foyer area there was somebody performing music, and residents were just really enjoying that yesterday. So it's great to see and be part of that. Now, for some of the listeners, they may not have an idea about where the Portage County Healthcare Center is located. So can you
Yeah, we're located at 825 Whiting Avenue, and that's on the corner of Whiting and Water Street, right next to the Ruth Gilfried building.
It makes it easy and easy
Very
access.
easy access, correct.
Yeah, right. There are, you know, most of us have an awareness that that counties are not required statutorily to provide health care kinds of services from a nursing home or rehabilitative center sort of standpoint. And yet our community, what'd you say, since 1931, has committed to having this center, which is truly incredible. Now, how common is that in the state of Wisconsin?
Well, of the 72 counties in Wisconsin, 36 counties, so half of our counties, continue to operate and support long-term care nursing facilities. Of the 398 nursing homes across the state, we're a small number, but when you look at by county, 50% are continuing to maintain and see the value and the benefit for providing that service to people in their community.
Wow. And actually, we were just talking about healthcare centers at last Friday's meeting when I attended the Wisconsin County Executives and Administrators statewide group. So, you know, these are topics that are very timely, and of course everybody is revisiting the whole commitment to providing this kind of local service to folks. Yeah, we'll get to more of that in just a few minutes. But so right now at the center, what we have is capacity for 100
residents. So we're licensed to care for 100 residents at any one time.
And I think I heard, as we were kind of getting ready for the show here, you were talking about you had 90% fill as of yesterday's numbers. So
right. So we're very close to what we projected for the year, and we're doing real well, and finding that we've got a lot of interest, and a lot of people are choosing to place their family members there for short-term and long-term care.
Now, regulation-wise, I mean, you've taught me a lot, and so did the previous director. Dale Hagan, and so wow, regulations guide the world of health, as many of us know. So talk with me about this, and also Dave, you've got some special licensing to even be in the role that you are, some special qualifications. So can you just teach us all about that?
Well, we have limited time, but suffice it to say,
we're not going to take out those
right.
binders that are this big.
You know, we are required to follow both state and federal regulations, and the rules are rather encompassing, and they're ever changing, and they evolve. You know, every month, every year, there's changes as we find better standards of practice, and as we move toward more resident-centered care. And as a skilled nursing home facility, all of the nursing home administrators are licensed and are required to be licensed within the state. And I've been fortunate through my schooling to actually have a degree in healthcare administration. So I focused my training on specific specifically long-term care administration.
Wow, wow. And so, you know, you have folks that stop in and they conduct inspections and so on and so forth. And what? Some of them are surprise visits and some of them are planned visits. Is that right? Do I get that right? Or are they all surprises?
Well, they're all surprise visits. We are surveyed annually.
Yep.
And other surveys happen when we make self-reports or if there are other kind of complaints that may come up. And we've been very fortunate to have had very good survey compliance. In our last year, we just recently received the consumer information report that the department provides, and in 2010 we only had one citation that was issued to our facility. The average in 2010 for all nursing homes across the state was about 7.5.
Wow.
Within the county, where there's just the 2 homes, the average was 4. So I think Portage County Healthcare Center, I think as exemplified by our surveys, have been doing an outstanding job.
Absolutely. And let's see, remind me how many staff are there at the center? Because you have a 24/7 operation. I mean, nobody's going home because we have folks that need care around the clock.
Right. Actually, we have about 164 employees that we employ directly by the healthcare center, but that doesn't include a lot of the different support staff that we receive through the county. We're fortunate to receive assistance from the county's human resource, purchasing,
Yep.
facilities department, legal, purchasing, the list goes on. So, but we do have a great number of people that we employ directly at the healthcare center.
And so, okay, we talked a little bit about how the Portage County Healthcare Center stacks up to the competition. Like, how much competition is there right here in our county again? How many other places could I choose if I was looking for a place for mom in Portage County?
In Portage County, there are only 2 skilled nursing home facilities. So
Okay.
we're one of 2 here located in Portage County.
All right, okay. And of course, there are the graduated levels of care that one needs to find the fit for. I know for my mom, many of the listeners have already heard me talk about the fact that I grew up with a parent who had been disabled since I was in middle school. So, for example, I would help mom get dressed before I would get dressed to go to school. And so when you grow up with somebody with some special needs, then as we get older, it's often, let's go shopping for some assisted care now, then let's go shopping for the next level of care, and you work yourself up to the skilled nursing care, which is the top of the chain, if you would, right? For the cost, because it's a different kind of service, and then also how again you find the fit. It's a fit for the environment with the individual that you're putting in, you know, you're having this become the home for, making this decision with that parent most of the time to find the right kind of home, and then find the balance and the right kind of, I guess, culture. There's a lot going on at the healthcare center that, as I mentioned, music at the beginning. But maybe one of the things is, let's just skip to program real quick.
Sure.
How the program works when I'm at the center. Maybe
Go ahead,
Stephanie?
Sure. We have a lot of different programs, you know, available for our residents. For activity-wise, you know, we are very involved in the community as well, because the residents really like to stay involved with their
nice.
community. So we recently did a food drive for Operation Bootstrap, which the residents really enjoyed, you know, gathering things, having their family bring in canned items or different things for them. We also have a lot of specialized programming for our residents who may have some issues with memory or dementia. You know, they do special sensory stimulation programs to kind of help maintain or to do our best to keep what we have going on. Obviously, there's a lot of music, like you were saying. We do different church programs. There's just a lot of things going on within our center, which we're very proud of. So
it just means so much, and it always did. Again, all of those years, Mom was in assisted and nursing kinds of care for about 10 years, and so we got a lot of experience as a family. Speaking of families, just to take that. And then maybe we'll get to some of the funding kinds of things. But how engaged are families in the life of residents at the Portage County Healthcare Center?
they're very involved. We have a lot of great family support from you know, our residents for our residents. You know, people visit throughout the day. We have a lot of families who actually come and eat meals with their loved one, which they really enjoy.
Great.
So we
Just like being at home at the dinner table.
We actually have some people who come in after their loved ones have, you know, passed, or maybe they've discharged, and they come back and they're like, hey, and they come talk to us, and so that's really nice. We get a lot of nice comments too from families when I brought some letters.
Do you mind just sharing one? That'd be great.
Definitely.
And then we'll get to the other one maybe later.
Yeah. This was to all the special dedicated caregivers. Thank you for caring for our mother, grandmother with overwhelming compassion, respect, and extreme kindness as though you were caring for your own loved one.
Wow.
Don't know if you realize the smiles and sunshine you bring to her life each new day. It makes it easier to leave her knowing she is being so well cared for and thought of. Thank you again. So,
wow.
We always like to hear that, obviously, as well.
Yeah,
so.
share them at staff meetings and stuff, I'm sure. Wow. And so let's talk a little bit about the funding. I mean, you have to make the business part work in addition to this compassionate care-related family extension sort of piece. So what about funding?
Well, the Portage County Health Care Center is funded through multiple funding streams. Our majority of our funding comes through state and federal programs. We receive about 40% of our funding through the family care and the Medicaid program. Additionally, we have about 20% of our funding coming through Medicare program, and that's a federally funded program. We receive additionally about 17% of our funding through the county support, and also from our healthcare center fund. Additionally, we have then about 12% of our residents that are paying privately or through managed care. So that's kind of our composition of our funding sources.
I know one of the conversations that I heard in a number of different settings in Portage County in the last year that I've been in office is, you know, getting back to basics and making sure that what county government is doing is what county government should be doing, because sometimes county government sort of evolves, right? And so we have to make sure that we're on the path that we intend to be on. And so I think, you know, again, back to the fact that counties are not required statutorily to provide a healthcare center service, if you would. We do, and we have been for going on 90 years or something like that. And so with that said, I'm sure that there will be a lot of conversation over and over again, deciding, recommitting to the fact that this is the path that the county government, you know, wants to be on in providing this alternative, this skilled nursing alternative and rehab alternative for citizens in the county. Yeah, lots of conversations you're having at the strategic planning table, aren't you?
Sure are.
Dave?
Yeah, it's a lot of big decisions, but I think you know, a lot of good input from our committee members.
Absolutely.
And people within the community and family members as well.
I've heard numerous times how grateful people are to have this resource in their community, and anyway, it's certainly a mission that will be important as we go forward too, because of our aging demographics. Right, so the population's aging, and I can't remember all those statistics about them, but yeah. Got any for me by chance?
Well, actually, there was a recent study done by the Department of Administration, and it was based upon the last census data. And in 2005, Portage County population over 65 plus made up about 12 to 14% of the population. And in the year 2035, that population is expected to double and to be about 24 to 27%. So we're going to be seeing more people aging and more people needing services.
Wow, for sure. When we take a look at, you know, these kinds of settings, one of the things that I remember with my mother was the fact that she felt more like a number when the staff would rotate in and out of these organizations, these healthcare organizations frequently. So today she didn't know who would be toileting her, tomorrow she didn't know who would be serving her meal and doing that program or whatever. Can you talk with us about the stability of staffing at the Portage County Healthcare Center?
Well, and interestingly enough, that specific information is provided every year in our consumer information report. And not surprising is the tenure that we have with our caregiving staff. And actually, Portage County has a 100% retention rate on our full-time nurses, 100% on our full-time LPNs, wow. 82% for our part-time nurses, and 100% for our part-time LPNs. And in the direct caregivers, where you have your nursing assistants, we have about 89% retention rate for our full-time nursing assistants. So we far exceed the state averages and the other averages in comparative in the county. So we're real proud of that, and that helps us to be able to deliver good continuity and a high quality of service to our residents.
Wow. So if I was interested in finding out more, because I'm looking at a possible admission in the future, just to talk about that. Talk about what kind of time frame should I be planning ahead, and who do I talk to?
Okay. If you're having a knee replacement surgery, we encourage people to call us as soon as they're aware of when they're actually having their surgery, like the date. We usually try to keep it on the calendar so that we can pre-plan with what other things we have going on within the facility. And usually, myself or our other nursing supervisors are good first people to kind of get in touch with. The doctor's offices usually contact us as well to let us know that there's someone going in for surgery and that they might need to come visit us.
So back to the kinds of folks that might come and might see themselves as needing this kind of service. Mm-hmm. So if I'm having a major surgery that I need some recovery time before I can go home, between the hospital and mm-hmm. home, Portage County Healthcare Center could be that kind of place. Is that right?
Definitely.
Absolutely.
Where else do I go if I don't go to places like this? I would have to go home and just have somebody else try to take care of me around the clock? Or?
Well, there are assisted living options and home health services, but when people need to have services available 24/7, typically they're needing then to be at a nursing home. And we're fortunate to have therapy staff that work 6 days a week and are there to provide that services directly on site to our residents.
Let me just ask, do we have a minute for another story, another card? Yeah. Before we have to wrap up today? Because this is just, I could talk about this all day long, but I know we don't have that chance.
Yeah, this next one that I actually brought along is from someone who was there for rehab, so it's kind of nice to hear those too. We want to sincerely thank each and every one of you for the excellent care provided to my husband during his 2-week stay. You're very caring and compassionate people, which Portage County residents are very fortunate to have. Wow. As a former county worker myself, I know what a great crew this nursing home has. We specifically requested this institution because of you all and know that the progress he made is attributable to everyone. Wow. Thank you so much for your services and keep up the great work.
Well, back at you, keep up the great work. Amazing. I have to say that I understand folks will be ready to tour visitors around to show them mm-hmm. so that people can get more comfortable. If you want to stop in, you want to plan ahead as we sum up here. We're here to help people make the best decisions and figure out how this goes in their lives, right? Yep. How to make the next better step happen mm-hmm. for themselves or their parent mm-hmm. or other family member. Right?
Right.
And then the other thing is I just want to also thank you for doing the heroes work of our community. This is truly one of the most important missions that people have in communities at large. It's the whole idea of how we treat our, most of the time, elders, and how you care for those who are in the last months and years of their life sometimes, or those that need to get on their feet more quickly to be able to get back into contributing to their community and keeping people engaged. I so appreciate that.
Thank you.
Yeah, I'll pass that along to the staff too. Well, listen, I want to thank you for tuning in. Next month we've got Gary Speckman with Portage County Parks, and we'll get you into what's going on at Standing Rocks Park in addition to lots of other places. So thank you so much. I look forward to seeing you next time with Portage County Matters.